Hello friends, welcome back to ManpreetRN Talks. In this video, we will discuss some practice question on the ethical principle in nursing. So without wasting the time, let's start the practice. Question number first, a competent adult patient refuses a life-saving blood transfusion due to religious belief. What should the nurse do? A competent adult patient है वो blood transfusion को refuse कर देता है due to their religious beliefs. So at the time, what should the nurse do? तो nurse को क्या करना चाहिए? Option number A, persuade the patient to accept the transfusion. B, notify the physician and document the refusal. Administer the transfusion to save the patient's life. D, contact the hospital ethics committee for approval. तो फर्स्ट हमने आइडेंटिफाई करना है कि कौन सा यहाँ पे एथिकल प्रिंसिपल अप्लाई हो रहा है। सो एथिकल प्रिंसिपल यहाँ पे अटॉर्नी अप्लाई हो रहा है बिकॉज इसमें क्या है कि पेशेंट को रिफ्यूज कर देता है ट्रीटमेंट के लिए। सो एज ए नर्स हमने क्या करना है, वी शुड नोटिफाई द फिजिशियन एंड डॉक्यूमेंट द रिफ्यूजल बिकॉज रिस्पेक्ट द अटॉर्नी मीन्स ऑनरिंग द complete patient decision even if it leads to harm. So as a nurse you should must inform the physician and document. The nurse sees a confused patient attempting to get out of bed unassisted. What is the best action? A. Restrain the patient immediately. B. Leave to call for help. C. Stay with patient and call for assistance. D. Ignore it because the patient has a low fall risk. In this question, patient is confused and he is trying to get out of bed with an assistant. So इसमें क्या है कि पेशेंट को हमने इंजरी होने से प्रिवेंट करना है। सो बेस्ट इस पेशेंट के लिए क्या है कि इसमें जो हमारा प्रिंसिपल है वो अप्लाई हो रहा है बेनिफिसेंस। इट मीन्स बेनिफिसेंस मीन्स एक्टिंग इन पेशेंट्स बेस्ट इंटरेस्ट मीन पेशेंट को हमने इंजरी से प्रिवेंट करवाना है। सो क्वेश्चन आंसर इसमें जो सही होगा वो होगा stay with patient and call for assistance because staying prevents harm while getting help. A patient is in severe pain but refuses pain medication. What should the nurse do? Administer the medication anyway. B. Respect the patient choice and offer non-drug comfort. C. Give a playback. D. Chart the refusal and take no further action. So इसमें जो प्रिंसिपल अप्लाई हो रहा है वो नॉन मालिफिसेंस मीन्स डूइंग नो हार्म. So first, there's a question is first administer the pain medication anyway. It reflect the violation of autonomy means patient का जो रिफ्यूज कर रहा है मेडिकेशन के लिए हमें उसको फिर भी फोर्स कर रहे हैं। सो autonomy जो प्रिंसिपल है उसको हम वायलेट कर रहे हैं। सो ए इज आउट. सो बी रिस्पेक्ट द पेशेंट चॉइस एंड ऑफर नॉन ड्रग कंफर्ट. इट मीन्स हम पेशेंट का जो रिफ्यूज कर पेशेंट ड्रग्स लेने से रिफ्यूज कर रहा है इट मीन्स पेशेंट की जो हम चॉइस है उसको हम रिस्पेक्ट कर रहे हैं and offer non-drug comfort, means like diversion therapy, for example, musical therapy, therapeutic talk with patient that can alleviate the patient pain. So it is right. So give a plebaco. Plebaco means it is a type of substance that is used when a patient is in pain, but it is a type of substance that has no effect. But patient thinks that she has been given a medication that relieves the pain. So इस क्वेश्चन में हमें पेशेंट ने सिविली रिफ्यूज कर दिया पेन मेडिकेशन लेने से, so we cannot give plebaco and we can chart the refusal but take no further action. That is not good. So correct answer is respect the patient choice and offer non-drug comfort. A nurse has two patients who both require pain medication at the same time. What principle guides the nurse in deciding the order of care? Versatility, justice, autonomy, and fidelity. The correct answer is justice, as justice refers to fairness and equitable distribution of resources. The nurse promises to return the pain medication in 10 minutes but get delayed. What ethical principle is at stake? So, non-maleficence, fidelity, justice, autonomy. So, correct answer is fidelity. Fidelity means keeping promises and commitment and build trust. A patient asked, is this procedure going to be painful? The correct ethical response is A. No, it won't hurt at all. B. It may be uncomfortable, but I will be there to help you through it. C. It doesn't matter, it's necessary. D. Let's wait for the doctor to explain that. So, answer is B. It may be uncomfortable, but I will be here to help you through it. It means veracity means being truthful. So provide honest information to the patient. An alert and oriented patient refuses a feeding tube, but the family insists it to be placed. So what should the nurse do? Respect the family's request, refer to the physician. C. Respect the patient's decision and inform the provider. D. Start the tube feed to avoid conflict. So correct answer is C. It means respect the patient choice and inform the provider. So here autonomy principle is applied. So autonomy means respecting the patient decision if even if the family disagrees. A nurse gives high risk medication without checking lab values, resulting in harm. What ethical principle was violated here? A. Justice. B. Veracity. C. Non-maleficence. D. Fidelity. So correct answer is C. Non-maleficence means do not harm. So in here, the nurse failed to act with necessary cautions. Patient asks, "Am I dying?" The nurse knows the prognosis is poor. What is the best response? A. You will be fine. Don't worry. What makes you ask that? C. You should speak with your doctor. D. Would you like to talk about your condition and how are you feeling? So correct answer is D. So here veracity is involved. So veracity means telling the truth. So would you like to talk about your condition and how are you feeling? So here first acknowledge the patient question and open a therapeutic conversation. So next questions are for you, friends. A hospital has only one ICU bed available. Two patients qualify. What guides the ethical decision? So the patient who has more visitors, the wealthier patient, the objective clinical criteria, D, first comes first serve. So correct answer you can tell in the comment box. A nurse tells a patient, "I will be back in 20 minutes with your pain meds," but forgets. What ethical principle has been compromised here? A. Beneficence. B. Fidelity. C. Autonomy. D. Maleficence. So, write down the answer in comment box. A nurse delegates a task to an unlicensed assistant and later learns it was done incorrectly. Who is ethically responsible here? The assistant, B, the patient, C, the charge nurse, D, the delegating nurse. So write down the answer in comment box. So it's all about practice questions. If you like this video, kindly subscribe my channel and to comment in the section. So thanks for watching.